I think the first question is that thing really going into my urethra? And of course we have to say yes. But at least it's not surgery.
We are Team Evacuator, a senior bioengineering team at Rice University. And this year we were tasked to design a biomedical device to remove blood clots from the bladder transurethral.
Older adults have blood clots inside their bladder. There are two main options. One is surgery, which is really costly and just unappealing to older adults and general population. And the other non-invasive or minimally invasive technique is using this syringe and catheter. So what happens is they insert this catheter through the urethra and blow up the balloon at the end and secure it at the neck of the bladder. And then they fill this syringe up with saline solution. And what they do is basically they just pump this saline solution in and hope that the force of that saline solution when it hits the blood clot breaks it up. And then they also pull back on it, so hopefully those repeated cycles of irrigation and suction will be enough to break up the clot. But the problem is this procedure is kind of like sucking Jello using a straw, so it's pretty ineffective and it just generally doesn't work. We've been tasked with creating a minimally invasive solution that uses the urethra to remove blood clots from the bladder.
So this is our first, conceptual prototype of our clot slayer device. Well, normally, this will be inserted into the catheter, and this end will be inside the bladder. And so our little cup here represents the bladder, and then the Jello represents our blood clot. Blood clots have a general, similar consistency as Jello, so just assuming we're already inside the bladder, and then you just run this a couple of times, and it'll take about not even a minute to get it down.
A lot of patients do suffer from blood clots in the bladder, and it's caused by anything ranging from urinary tract infection all the way to cancer. And so this is something that's very serious. I mean, if left untreated, these blood clots could actually lead to kidney failure. And I think for us to be able to come up with a device that successfully breaks up blood clots into small slivers, I think that's a very big step forward when it comes to medical devices in this area. It really allows patients to really avoid a lot of complications associated with blood clots in the bladder. And I feel like that's where our device is special.